Hello guys, today we're going to talk about ball pivot biomechanics. This is very important to understand the clinical biomechanics of the spine. This is functional in the facet joint and also in the disc.
The posterior spine is supported by ligaments and facet joints. These facet joints represent a double support with one facet on each side. The anterior part of our spine is composed of the vertebral body, which are primarily supported by a viscoelastic structure called the nucleus pulposus, which represent the spherical mobility support contained by the annulus fibrosus. The nucleus pulposus represents a single support structure forming a unified pillar that moves forward, backwards, and sideways with greater versatility of movement. Here we can observe the annulus fibrosus, which are nothing more than a fibrous ring structures, which act as if they were ligaments, which delimit the spheric mobility of the nucleus pulposus. The health of the intervertebral disc is crucial, and we note it, especially when we understand the function of the nucleus pulposus, a key component of the spinal mobility. Injury to this nucleus pulposus can overload the facet joint support system. We will discuss facet joint syndrome later. When this disease occurs, this annuli may become more mobile or stiffer than normal, and depending on the stage of the disease, they may rupture or even fibrosis. These changes in the integrity of the intervertebral disc can promote biomechanical asymmetry and allow the nucleus pulposus, our spheric pivot, to move abnormally, causing dysfunction that impairs the balance of forces and leads to biomechanical stress on the facet and the disc, causing sensory interference and mobility deficit. Not to mention that the loss of integrity of the fibrous rings can promote the extrusion of the nucleus pulposus, which can compress the intervertebral root. This can promote signs of neural compression, such as symptoms in the arms and the legs. In summary, the biomechanic support of the spine is formed by three supports. Two posterior support formed by the facet joints, which are responsible for stabilization during extension and lateral tilt, and one anterior support with a spheroidal biomechanics appearance, promoting movement in all directions, and this is the spherical pivot. The health of the intervertebral disc is crucial, and we note it, especially when we understand the function of the nucleus pulposus, a key component of the spinal mobility. Injury to this nucleus pulposus can overload the facet joint support system. We will discuss facet joint syndrome later.